absolutely delighted to welcome you, Ellie, today. This is Dr. Cannon, who is author of the Little Book of HRT. Absolutely brilliant to have you to chat about hormone replacement therapy. You are a leading NHS GP, you are a fellow of the Royal College of GPs and a regular face on TV and radio, commentating on women's health. And today we're talking about hormonal health and options, whether or not to take HRT. So let's talk a little bit about, why you decided to write the book.
Yeah, so I decided to write the book because, as you say, we've been talking about menopause and hormones, quite a lot in the last few years. Obviously, you know that in your work. And so there's a huge amount of information out there. But I definitely felt there was a lack of the right information, just some basics like what is estrogen, what is testosterone, what is a patch, so some basics. And also I think a lot of the information out there is actually sort of consumerism, so people trying to sell you stuff which doesn't serve women very well. And also that excludes a lot of women because most women are going to their NHS GP for menopause care. So yeah, there were lots of reasons, but really I think to empower and really to include more women.
So before we delve into HRT in more detail, just for those that are really new and might not be sure about what we mean by HRT, can you just explain what it is, what's the purpose of it?
So HRT means hormone replacement therapy, and when a woman goes through menopause, there's one big hormone called estrogen which drops, and it's that dropping of the estrogen which causes all the symptoms. So the big classic ones like hot flushes and night sweats, and then also other ones that we don't talk about so much like dry skin and joint aches and all sorts of things. So it's the estrogen dropping. So HRT replaces the estrogen. So that's the sort of headline, that it's replacing the estrogen. We actually also give other hormones often and less often. So we often also give progesterone, which is another hormone, and we sometimes also give testosterone. But we're replacing the hormones that drop during menopause.
Fantastic, thank you so much. And also there is something called topical estrogen. Do you want to just explain when we might use that?
Yeah, so topical estrogen, in fact, my friend who read my book said to me, oh Ellie, you really love topical estrogen, you write about it a lot. So yeah, I'm a big fan of topical estrogen. Basically, when we talk about HRT, there's loads of different forms, and one form is topical or vaginal estrogen. And that basically is used either as a pessary, so a vaginal tablet, or as a vaginal cream. And it's used into the vagina, you apply it in the vagina. And we give it to women who have bladder problems associated with menopause and vaginal problems. And one of the reasons why it's so good and it's so popular, and you can actually buy it over the counter, which a lot of women don't realise, you don't have to get it from a doctor, you can get it from a high street pharmacy service, is that the hormones just stay in the pelvis. So that means that you're not going to get side effects around your body. So any medication that you use locally is going to be sort of good for you because it's just staying where it sort of does its work. So it's a really good option, but only if you've got those type of symptoms.
Brilliant, thank you so much for explaining that. So HRT, for those kind of coming into perimenopause and even beyond, there's a lot of pressure right now for people to be on HRT. Not everyone can take it, not everyone wants to, but it can almost feel quite create anxiety for people that might not want to go down that route. Where is this coming from, and what's your sort of thoughts on that?
So I think that's really valid, and that's probably, one of the main reasons why I wrote the book. There is this huge pressure now on women. It's become, as I say, it's become very consumerist, definitely. So there's people who are influencers, and I don't just mean sort of celebrity influencers, I also mean medical influencers and sort of other people who are really sort of extolling the virtues of HRT all the time. So definitely that adds to a lot of pressure. I've even seen women in clinic, I wrote about them in the book, who have FOMO because they're not on HRT, you know, so they sort of feel, oh, I should be on it. So there's definitely a lot of pressure, either from people who are selling HRT or from people who are prescribing it in private clinics. Also, I'm sure, as you know through your own work, there's sort of now a massive meno industry, you know, where there's sort of a lot of products sold to promise you a great menopause, like skin creams and this and that have probably got nothing to do with menopause. So there's just a lot of pressure on women now to have a really positive menopause, whatever that looks like. And to buy products or get products like HRT, etc., to make it great. But that's not realistic, because actually a lot of women don't need HRT, can't take HRT, don't like HRT. So I was very keen in the book, despite the huge letters on the front that say HRT, I was very keen that actually I've spent half the book talking about what you can do if you don't take HRT.
Brilliant. Well, we're going to come on to talk about lifestyle and other things. So just if you were to sum up the benefits of HRT for some people, what are the main things?
So the main things are, so HRT is designed to treat your symptoms of menopause, and for many women those symptoms can be really life altering. You know, they ruin your sleep, your relationships, your ability to work, really make you feel bad. And that's the benefit of HRT, is if it works for you, it will treat those symptoms. In the same way that if you had a headache or a chest infection, you would take medication. It's just the same as that. So the benefits, you know, it's not uncommon that I will start a woman on HRT and she will come back 8 weeks later saying that her life has changed. So if it works well, it's really doing that as a great job. It's also, you know, because it's the estrogen, it's also good for bones. So some women are taking it actually not for symptoms but for the bone thinning disease osteoporosis, so we know that's good. And another benefit, which again we don't talk about enough, is that women who've gone through either an early or a premature menopause, so anything sort of before the age of 45, then they are reaping a lot of benefits from HRT to have the estrogen that they've otherwise missed out on, and that's very good for heart health and also for bone health.
So some people will take it for the benefits, not just for the here and now, but also long-term health.
Yeah, that's right. Now, again, that's something, so the long-term benefits are something that's oversold with HRT, and you see a lot of that online. I'm taking it sort of, you know, for the future, to prevent dementia, to prevent this, to prevent that. That's all a bit oversold and actually not very evidence-based. But absolutely, if you've gone through an early menopause, a premature menopause, or if you have medical conditions and you are advised to take it, then yes, it has benefits for your long-term health.
What myths do you bust in this book?
Oh, I've got a whole chapter on myths. So lots and lots of myths. I suppose that HRT is for everybody, and it's not. That all women have to take testosterone, which is something, again, that's sort of all over the online marketplace at the moment. So that's, you know, not really the case. Also as well, I suppose that HRT, you know, over the years we've had some issues with the research that shows HRT causes breast cancer. So there's a lot of women who believe that blanket causes breast cancer. Actually, it's quite a low risk in terms of the sort of association with breast cancer. It's not as high as drinking alcohol regularly or being overweight. So it's actually a very small number of women who get breast cancer from HRT. So that's a myth that we bust. That it's a panacea, really, because it's not. So sort of good and bad things. There's lots of myths around there, which is always what happens when people are trying to sort of sell you something, I think.
Definitely. So in the book, you're clear you're not anti-HRT, but you're not telling everyone to take it. So what are the other options that people can explore?
Yeah, so there's lots of other options in terms of sort of hormones and menopause, and actually they can be used with or without HRT. So there's things that people wouldn't even realise are alternatives. So for example, we know that having specific form of therapy like CBT can be valuable for hot flushes and some of the mood changes with menopause, as long as you're doing it in a sort of specific menopause program. Things like pelvic floor physiotherapy, which is completely underused and undervalued in the UK, is fabulous for a lot of the pelvic symptoms of menopause. Exercise, food changes. There's medications that are not hormonal, so there's some sort of like quite new ones now, and there's also sort of older ones that we've used for hot flushes. Antidepressants are very sort of controversial anyway, but they're controversial in sort of menopause. But for some women, particularly if you've been a woman who's been on an antidepressant before and you found them valuable, they can be helpful for the mood changes. So there's lots and lots of different options, very simple things like just using a vaginal moisturiser or a lubricant. So yeah, lots and lots of things.
Brilliant. So for somebody that is coming in, trying to work out how to manage their symptoms, if they're considering HRT, what are the important questions that they should ask their GP or to do some research on?
So I'd say the important questions are definitely knowing your family history, because that can be relevant to HRT. So particularly in terms of blood clots and breast cancer, which can be sort of associated risks with HRT. Background sort of health as well. So if you're thinking about menopause at that time in your life, you should also be starting to think about your bowel cancer screening, your breast cancer screening, your heart health screening. So that's a time to sort of add all of that into the mix as well. And then in terms of, specifically around the HRT, you really have to go into a GP appointment with your information, and it's amazing how many empowered, educated, bright women I see who can't tell me when their last period was, or who can't sort of tell me the exact time frame of their symptoms. So it might seem sort of like trivial and simple, but actually writing down your last period, or obviously there's 1,000 apps now you can sort of measure that on, and also having a bit of a symptom diary, just means you're sort of going in with that objective evidence.
And just to build on that, for anyone that is listening, we also have evidence-based information, free resources on our website. So we have a symptom tracker and also a clinician checklist.
Brilliant.
So if people want to know how to get the most out of their consultation, they can access that. So what about the different formats? Can you just cover quickly what they are and some of the pros and maybe the downsides of them?
Yeah, so estrogen, which as I've said is like the main hormone, it's a really clever medication actually compared to other ones, in that you can actually make it in lots of different forms. We can't say that about lots of other medications. So HRT, I've already talked about vaginal estrogen, which is one form, actually two, because there's tablets and cream. But HRT actually comes in tablets, patches, gel, spray. It's all sorts of different sort of things. And the reason why you might choose one or the other often is personal preference. So I think still actually the tablets are the most commonly prescribed in the UK at the moment still. We might sort of recommend to a woman that she uses one of the skin-based treatments, so a gel or a patch or a spray, if there's a potential risk of blood clots or stroke. So maybe because you're a smoker, or because your mum had a stroke, or that sort of thing. So we know that the skin-based treatments don't carry that risk. But then they might carry downsides for other women. For example, using an estrogen gel involves rubbing in the gel and then leaving it to dry, which is fine, but some women don't want to do that. So there's a bit of individual preference, and then there's a bit of sort of background health problems. We also use the contraceptive coil, the Mirena, often as part of HRT. It provides the progesterone as part of the HRT. if you're a woman who's had that before and you like it and you've already still got one in from contraception, then you might be inclined to carry that on. So there's sort of like lots of different sort of ways, I suppose, like a bit of an algorithm really, that pushes you in the end to a certain decision.
And am I right in thinking that sometimes it's not always one gets the format right the first time, so you might have to kind of play around and try what's working for you?
Yeah, absolutely. So there isn't sort of like a standard scale where we can sort of, you know, plug all your sort of details in and then say, well, absolutely, you know, what I'm going to have for Leslie is going to be the sort of 50 patch, this brand, this, that and the other. We don't know until you try it. So as I say, we use some sort of criteria, hard and soft, to sort of veer you in one direction. But it's a bit like when, you know, women need contraception and you try contraceptives and you don't know how it's going to go. Unfortunately, it is a suck it and see approach to start with, and often we do get it right first time and sometimes we don't. Actually, I have to say that is the case with lots of medications. So what I've just described is exactly what happens if you have high blood pressure and you go to the doctor. There's lots of options and we just start with something, but it might not work out. So it's quite a normal approach.
Just before we close, anything you'd like to say more about the book? Any chapters that we haven't covered?
Well, I think it's definitely supposed to be, as you said, the GP consultation. And so I've really found in practice with my own patients, actually, it's been pretty helpful if people have read it before they've gone in, because there's things people don't necessarily think about, you know, asking your siblings or your mum what their menopause was like. Understanding that there's no time scale for HRT, so you can go to the doctor well after your menopause if you want, and you can also go well before, so there's no time scale. So I think it's just lots of facts, and hopefully it is really empowering for people before their appointments.
It definitely is.
Good.
I recommend it. What would you like to see in terms of the future of HRT?
Well, that's such a good question. So I think like the future of HRT, I don't think there are good enough medical options for women who have had or have breast cancer and want HRT. So we've had a couple of new medications sort of brought out in the last couple of years. They are still mostly contraindicated for women with breast cancer. I don't think we've got enough options yet. So that would be my goal. Certainly from what I see in practice, I think those women still feel quite excluded.
Brilliant. Well, hopefully they will also be able to read this and feel that there are some other options as well. So thank you so much for chatting today. We're also doing a giveaway, so if you would like a copy of this, just tell us why. For those of you on Instagram, all we need you to do is to add a comment when you see this reel and to re-share the reel to somebody in your network and let us know that you want a copy. And for those on our newsletter, there will be a link for you alongside how to get a copy of the book if you want to purchase it. So thank you very much.
Thank you.